Okay, so we are going to be starting the muscles of the lower extremity. So let's start the screen share here. And you'll go into the exam 3 info folder. And when you scroll down, we'll get to lower extremity leg model, labeled and not labeled. And when you get into that, then we get the entire lower extremity. All right, so let's take a look. Let's start with, let's look at the front here. So here's the entire limb, right, from upper to lower. So let's see what we have on the front here. So when we look at the hip, right here in the front, we have these two muscles together are typically referred to as one muscle, and it's typically referred to as the iliopsoas. Iliopsoas. That's when the muscle is pointed to underneath this structure, which is called the inguinal ligament. When they point to these two muscles here on the bottom, it's the iliopsoas muscle. When it's isolated and split into two very clear different muscles, here it's the iliacus, here it's the psoas major. Now, both of these, when they come together, they go underneath the inguinal ligament and they'll attach to the lesser trochanter. And because it's a muscle that's in front of the thigh and in front of the hip, it is the primary hip flexor, meaning it raises your hip forward as if you're taking a step and you want to walk steps at the hip, you'll get hip flexion. The iliacus originates here on the iliac fossa. Remember that term? Iliac fossa. The psoas major, just FYI, clinically speaking, when this muscle is very, very tight, it attaches not only to the vertebra, but the discs as well. So when this muscle is hypertonic, meaning increased tone and tension, it can pull on the discs and create disc herniations. It's a nasty muscle when it's overused. All right, let's see what else we have here. Here's the ASIS, right? The anterior superior iliac spine. And you can see just inferior to it, we see an upside down letter V, right? Because there's two muscles that originate on the anterior superior iliac spine. One of them is the TFL, right? It's the Starbucks muscle, tensa fasciae lata, tensa fasciae latae, right? That's your TFL. On the exam, you can't put TFL if it happens to pop up there. You have to write tensor fascia latae. The other muscle that originates on the anterior superior iliac spine, the ASIS, is the Sartorius. The Sartorius is the longest muscle in the body. You can see that it originates on the ASIS. It's superficial, it comes down and it attaches right here. It crosses over the knee and attaches medial to the tibial tubercle right here on this region called the pes anserine. The pes anserine translates to goose foot, okay, the foot of a goose. And it's actually attachment of three muscles, three tendons attach here. The sartorius, the gracilis, and then one on the posterior, it's a hamstring called the semitendinosus. So the semitendinosus, gracilis, and the sartorius all have the same common insertion on the pes anserine. The sartorius is what I call a Faber muscle. Think of it as your favorite muscle, not favorite with a V, favorite with a B. B as in boy. Faber. F stands for flexion, AB for abduction, and ER for external rotation. The sartorius muscle flexes the hip, abducts the hip, and externally rotates the hip. That's the action. Almost like you're sitting with your legs crossed in a figure 4 position. You have to flex it, abduct it, and externally rotate. That's the talar muscle, the talar. Okay, that's the Sartorius. So the TFL is a very short muscle here, and it originates on the ASIS, but it inserts on this structure here, which you can see a little bit if we hone in. It kind of blends in with what's next to it, but it is called the iliotibial band. And it starts here, it goes down, it goes down, it goes down, 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 and attaches right here. It's called the iliotibial band or the iliotibial tract. We'll see it when I rotate this to the side and we look at it from the lateral view. So the TFL is a hip abductor. It abducts the hip. You can also flex the hip a little bit because it is anterior, but because its attachment is on the iliotibial band, which is a lateral structure, it abducts. All right, what else do we see here in the front? Well, we see 3 of the 4 quads, right? The quads are 4. Quadricep means 4, but we see 1, 2, 3 of them. The 4th is hidden under this. It's hidden under the rectus femoris. So if we peel the rectus femoris and pull it away, we would see the last quadricep muscle, which is called the vastus intermedius. The other is the vastus lateralis and vastus medialis. So vastus medialis, vastus lateralis, deep to this muscle would be the vastus intermedius, but superficial to it is the rectus femoris. The rectus femoris, which is here, it's the only muscle of the 4 quadriceps that crosses not just the knee joint, but it also crosses the hip joint, because this one originates, if we peel the Sartorius away and peel the TFL away, it doesn't originate on the ASIS, it originates below it on the AIIS. And then all of the quadriceps cross over the patella or the kneecap, and their final destination of insertion is here on the tibial tubercle or tibial tuberosity, so that when your quadriceps contract, it extends the knee or extends the leg. Leg extension or knee extension. We know that muscles attach to bones by way of tendons. So up here, going from these muscles to the patella, this is the patellar tendon. So what is it called when it goes from the kneecap to the tibial tubercle? Because now this is going bone to bone. This is called the patellar ligament, because ligaments go bone to bone. But from a functional perspective, really all it is an extension of this. It's just an extension of this tendon crossing over. So if we want to name it from a functional perspective, then we can, and then we'd call it a tendon, but it's the infrapatellar tendon. Up here, it's the patellar tendon, below infrapatellar tendon, okay? So again, all the quadriceps cross the patella, attached to the tibial tubercle, and when they contract, you'll get leg extension or knee extension. The only one that crosses the hip is the rectus femoris, so it can actually do hip flexion as well. On the medial compartment, on the inside, we see the pectineus. This is the pubic bone. So we see a very short muscle up here called the pectineus. Then there's the adductor longus. And if there's an adductor longus, there's going to be an adductor brevis. And the largest of all is the adductor magnus. There's 3 adductors. The most medial, closest to the midline, is the second longest muscle in the body, called the gracilis. The gracilis. Remember, it has the same insertion site as the Sartorius does, which is on the pes anserine. As we go down, we can see the anterior compartment of the leg, the tibialis anterior. It's named by its location. We see it in the front of the tibia, and it attaches here on that first metatarsal and first cuneiform. It is a primary foot dorsiflexor. It dorsiflexes the foot. So what's dorsiflexion of the foot? It's when your heels are on the floor, your calcaneus is on the floor, and you bend your ankle, your toes come up, the plantar surface of your feet come up, but your heels are still on the ground. That's called dorsiflexion. Plantar flexion is when you step on your tippy toes. That's plantar flexion. So dorsiflexion, any muscle that's in the anterior compartment will dorsiflex the foot. The other biggie is the extensor digitorum longus. It comes down and attaches to digits 2, 3, 4, and 5. Okay, on the back, right, we're not looking at this from the posterior, so we can just see a little bit of the soleus and the gastrocnemius. We'll take a closer look at this from the lateral view and the posterior view. But this is just a general view showing you what you can see from the anterior side. Okay, all right, let's take a look at the next one. Okay, so we did this one. Now we're going to take the hip. Let's look at it from the side view. Actually, you know what? Before we do that, I want to show you what happens when you peel off the rectus femoris. So let's look at this one here. Okay, so this is still the anterior of the hip, and it looks a little bit different. This is the tensor fascia latae, and this would have been the sartorius, but it's cut, so we can see what's deep. Here's the vastus lateralis. Here's the vastus medialis. Those are two of the three quads. Here's the vastus intermedius, right? Intermedius because it's between the two other vastus muscles. So those are the three vastus sisters. Vastus just means immense. Which one was cut? The rectus femoris, that most superficial one was cut. You could still see the adductor muscles. Here's the pectineus, here's the adductor longus, and then you could see a little bit of the gracilis right there. There's the gracilis. All right, let's look at the thigh and the hip and the leg from the lateral perspective. All right, so when you look at this, you have to say, all right, the foot is facing anterior, right here. Here are the toes. So this is the front, this is the back. And here you could see the TFL, the tensor fascia latae. It originates on the ASIS, but I said it inserts on the iliotibial band because it goes from the ilium up here down to the tibia down here at the bottom. So it's the iliotibial band, aka iliotibial tract. And this is a really nice view and perspective because it shows here that there's two muscles that actually attach there. 1, 2. So on the posterior side, you got the gluteus maximus. That one inserts on the ITB, and so does the TFL attach on the ITB. So this one can flex the hip, move it forward since it's anterior. This one can extend the hip since it's on the posterior. It's a hip extensor. So gluteus maximus, deep to it, if we took this off, we could see the gluteus medius. You could definitely see the anterior portion of it. The gluteus maximus is your primary hip extensor. So if you're sitting down and you go to stand up, your glute muscle will contract. This is the stairmaster muscle, the gluteus maximus. Climbing stairs, you have to extend the hip to do it. Gluteus medius is your primary hip abductor. So AB, that's right, hip abductor. So if you were lying on your side, lying down, but lying with one side on the ground, and you were to lift the other leg up in the air, that's hip abduction. Abduction, AB. Okay, as we move down, we could see the lateral hamstring. I'm sorry, my bad, the lateral quadricep. That's the Vastus Lateralis. And now we can see one of the three hamstrings. So the quads are in the front, there were four. The hamstrings are in the back, there's three. One on the lateral side, two on the medial side. So since we're looking at this from the lateral perspective, we cannot see the two on the medial side very well. So the bicep femoris, bicep means two. There's two heads, a long head and short head. The bicep femoris inserts here on the head of the fibula or the fibular head. Where does it originate? Well, you have to peel off the gluteus maximus to see that. And we will take a better look at it when we rotate this around so we could see it from the posterior side. But the hamstrings are going to originate on the sit bone. The sit bone is called the ischial tuberosity. You remember the ischial tube. We covered that when we did bones. I wanted you to know the difference between the ischial spine and the ischial tuberosity. The reason why I wanted you to know the ischial tuberosity was because the hamstrings originate there. That's up here. All right, what else can we see here from the lateral view? We're looking at the lateral leg. We could see a little bit of the anterior side, but we can focus on the posterior. So let's zoom in here. On the outside, we have the Fibularis Longus, which is superficial. And we could see the tendon come down here. And then we have the Peroneus Brevis. Sometimes the word Peroneus is interchangeable with Fibularis. So you'll see in certain books, Fibularis Longus, Fibularis Brevis, or Peroneus Longus, Peroneus Brevis. So the superficial one, which is up here, and then the tendon, follow it, it's right in the center. It's right in the center, right here, and it comes down, and then it goes underneath the foot. Whereas the Peroneus Brevis, it looks like the feather. We can see it here and here, okay? So that's the Peroneus Brevis muscle. So Peroneus Longus is here, and Peroneus Brevis here and here. If we look at the brevis inserts here on the lateral side of the leg. On the posterior portion, we have the Gastrocnemius, which is superficial. Here's the Gastrocnemius, superficial, and deep to it, we have the soleus. The gastrocs and soleus, both of them attach here to the calcaneal bone, and they're plantar flexors of the ankle. They plantar flex the foot, okay? So gastrocnemius, and because we're looking at this from the lateral side, the gastrocnemius has two heads. It has a lateral head and a medial head, but because we're looking at the foot from the lateral side, we can only see the lateral head of the gastrocnemius. When we look at it from the posterior side, we can see both. I promise you, we'll take a look at that. The Peroneus sisters here, Peroneus Longus and Brevis, since they're on the outside of the leg and the tendons are here, they could bring the foot outward, which is called foot eversion. Not inversion, but eversion. Eversion. Okay, let's go back. Let's look at the posterior portion. Now you can really see, so we're looking at the sacrum is here. Here's the posterior part of the iliac crest. There's your gluteus maximus. Now we can see the hamstrings on the back. Here's the lateral, here's the medial. The lateral one we could see is the bicep femoris, and we have the medial ones, which are the semi-brothers, the semitendinosus and semimembranosus. Semitendinosus is more superficial, right? You can see semitendinosus, and the one that's deeper to it is the membranosus. So the semi-sisters or semi-brothers, both of those are on the medial portion of the posterior thigh, and the lateral is the bicep femoris. So how many hamstrings are there? 3. One is the lateral, and the two semi-sisters on the medial portion, semitendinosus and semimembranosus. Now, similar to the quadriceps, right? The quadriceps were on the anterior portion of the thigh. Hamstrings are on the posterior. The quadriceps extend the knee or extend the leg. So what will the hamstrings do of the knee? The opposite. So if the quads do knee extension or leg extension, the hamstrings have to do leg flexion or knee flexion. Much like the quads, there was one of them, which was the rectus femoris, that crossed the hip. And if it crosses a joint, it has to act on the joint. So the rectus femoris not only flexed the hip, but extended the leg. The bicep femoris, which is the hamstring, that one crosses the hip and the knee as well. So this one, especially the long head, will, since it's on the posterior side of the hip, what will it do of the hip? Well, it's got to pull the hip back. And when I say hip, I'm referring to the femur. So that's going to be hip extension. So it extends the hip, but flexes the knee. Okay. The same thing is true for the semitendinosus and membranosus. Since they attach to the ischial tuberosity, they will extend the hip, but flex the knee. So the quads and the hamstrings are 100% antagonistic to one another. The quads will extend the knee, the hamstrings flex the knee. The rectus femoris can flex the hip, the hamstrings extend the hip. They're completely antagonistic. All right, now we can look at the posterior portion of the leg. And now we can see the gastrocnemius. Now on the exam, you have to be more specific because the gastrocnemius has two heads. This is the medial head. This is the lateral head. Lateral head, gastrocnemius, medial head, gastrocnemius. Well, this is the pinky toe. The pinky toe is lateral. The great toe is medial. The gastrocnemius crosses the knee joint, whereas the soleus does not. So general rule of thumb, if a muscle crosses the joint, it has to act on the joint. Since the gastroc crosses the knee on the posterior, it can flex the knee. It's not its main primary action. Okay, its main action for the gastroc and soleus is going to be at the ankle. What will it do at the ankle? What action? Plantar flexion. Ankle plantar flexion. This is the Achilles tendon. So the gastrocnemius and the soleus attach to the calcaneus by way of this tendon right here called the Achilles tendon. Okay. Okay, let's see what else we have here. Let's look at we did this. Let's look here. Okay, you guys still with me?
Yeah.
Perfect. All right, so now from this perspective, let's be clear what we're looking at. This is the lumbar spine. This is the sacrum. This is the coccyx. We have a muscle here that was superficial, that was cut. The muscle that was cut is the gluteus maximus. So the gluteus maximus is cut. We could still see gluteus medius. And now we see some muscles that are called the deep lateral rotators or deep external rotators. These lateral rotators or external rotators are going to externally rotate the hip or the femur. They all attach to the greater trochanter. So based on the direction of these muscle and muscle fibers, when you go from origin here and inserts, it's going to rotate the greater trochanter externally, which points the foot and flares the foot outward, kind of like a clown walking with the feet rotated outward. You can kind of visualize that. The yellow structure right here is called a sciatic nerve. It's a landmark nerve. It's the largest nerve in the body. And the reason why it's important is because the muscle just above it is the piriformis muscle. Okay, piriformis. It's spelled P-I. I don't know why there's a Y there, but it's P-I-R-I-F-O-M-R-S, piriformis. It originates on the anterior sacrum and attaches to the greater trochanter. Okay, there are other lateral rotators as well. The one that's the most inferior is this one here called the Quadratus Femoris. Okay. The lateral rotators are referred to as please go quietly muscles. And if you take the first letter of that sentence, please go quietly, the P in please is piriformis. Go, G-O, the first G is gemellus superior, the O is obturator internus. Please go, but there's another go, G-O, gemellus inferior, and then there is an obturator externus, which you can only see from the anterior side. So please go, and then quietly, the Q is Quadratus Femoris. Just a little silly sentence to help you remember the names of the 6 lateral or external rotators. Please go quietly. Now, this is a really nice picture because since the Gluteus Maximus is cut, we can now see the hamstrings at their origin. The origin is this bone called the ischial tuberosity. Ischial tuberosity. So this is lateral, this is medial. So this would have to be the Bicep Femoris. The superficial one, semitendinosus. And if we moved further down and deeper, you could then see the semimembranosus. Okay. Again, Gluteus Medius is a hip abductor, piriformis, hip external rotation or hip external rotator, as all of these please go quietly muscles do. They're all hip external rotators. Okay, let's look at the inner portion. I don't think we did this one yet. So let's look at the medial side. Okay, so here's the lumbar spine, right? It's cut. So now we can look inside. As we look inside, here's the pubic bone. This is medial because look, here's the great toe, which is the inner toe. So we're looking at it from the inside. So you can see your adductors on the inner thigh. The longest one right here is your gracilis. And look what's anterior to it, Sartorius, from the ASIS all the way down. And look at the semitendinosus. Now, when you have the semitendinosus and we look at that and we follow that tendon from here, here's the belly of the muscle, let's follow it down. Here is the pes anserine, there's the goose foot. So you have the you have the Sartorius that inserts here, the gracilis that inserts here, and the semitendinosus, Sargent, SGT. SGT, Sargent, Sartorius, gracilis, T, tendinosus. And then this large muscle right here that occupies most of the medial compartment. It's large, so it's Magnus, adductor magnus. Adductor longus, gracilis, adductor magnus, they all adduct the hip, or adduct the thigh, or adduct the femur. They're all interchangeable. And because we're looking at the thigh from the inner side, you can see the inner quadricep. That's called vastus medialis. So just knowing what you're looking at, your anatomy, and asking yourself, okay, this is the front, and this is the back, this is the inside, this is the inside, right? Just thinking it through logistically can help you. From the medial perspective, again, you could see the gastroc, but because we see the great toe, this is the medial head of the gastrocnemius. Here's the medial portion of the soleus. You don't have to say medial portion, you would just say soleus. Both of these make up an insert on the calcaneus by way of the Achilles tendon, the most common tendon in the body to be ruptured. Okay, so we did that. We did this. Let's make sure we did this one. Okay. Here's the sacrum. Here's the gluteus maximus. Again, on the posterior side, here's the bicep femoris, semitendinosus, semimembranosus. Here's your gracilis on the inside. Okay. Let's look at the lower leg. Okay, so lower leg, anterior side. This is called the dorsum of the foot. It's the top of the foot. The largest muscle and a powerful dorsiflexor is the tibialis anterior. It's very medial on the anterior side. It goes from the anterior tibia. If you follow it down, it kind of goes to the inside of the foot to that first metatarsal and first cuneiform. It's a powerful dorsiflexor of the foot. So foot dorsiflexion or ankle dorsiflexion. But because it goes to the inside of the foot, it's a foot inverter. Foot inversion is when your foot is planted on the floor and you roll your foot in, right? So that the outer side of your foot is on the ground, but the medial arch is lifted up. That's called foot inversion. In the front of the leg is the extensor digitorum longus. If we follow the belly of the muscle and we follow it down, it will have tendons going to the second, third, fourth, and fifth toe. That's the extensor digitorum longus. And on the outer part of the leg, we can see the superficial Peroneus longus. Okay, you can see a little bit of the tendon here, but again, not the best view to observe a muscle on the outside of the leg, but you can see the belly of it. The tendon, you would have to rotate this all the way around so you can see it on the lateral side. Let's look at it from the lateral side now. So now we can see the extensor digitorum longus. Again, not the best view to see a belly of the muscle that's on the anterior leg, but you can at least see the belly of the muscle, not the best to see the tendons. Here is the Peroneus longus. It's the superficial lateral leg muscle. Here is the tendon of it. If we follow the tendon down, it goes posterior to the lateral malleolus. It goes underneath the foot, and it makes a stirrup. It kind of attaches to the inner compartment of the foot. Same exact spot as the tibialis anterior, except not on top of the foot, on the bottom of the foot, the first cuneiform and first metatarsal. On both sides of that tendon, you could see the Peroneus Brevis or Fibularis Brevis. This one has a superficial attachment right there to the head of the fifth metatarsal. Because the belly of these muscles are lateral, And you can see that this one attaches here. This is a foot everter, foot eversion. You can see the lateral head of the gastroc. You could see the soleus. You could see a bit of the Achilles tendon right here. Gastrocnemius and soleus are foot plantar flexors. Let's take a look at the same view, but now what we're doing here is the great toe. So right here, what they took away is the gastrocnemius medial head, okay? So the arrow that's pointing to here should really be here, right? Because the arrow is pointing, this is the lateral head of the gastroc. What was removed was this, which is the medial head of the gastroc. When you take that away, you can see what's deep to it. It's this large soleus. It's a powerful ankle or foot plantar flexor. And it doesn't cross the knee like the gastrocnemius does. So it's a strong, powerful foot plantar flexor. And this is something that's important to know from a therapeutic standpoint, is when we're trying to rehabilitate the foot plantar flexors, we can do it differently. So people do calf raises, and sometimes calf raises are done standing with the knee extended, and sometimes people can do them seated with the knees bent. And the reason why we help rehabilitate people both ways, with the knees extended doing calf raises and the knees bent doing calf raises, is to take out certain muscles and to isolate certain muscles. Since the soleus doesn't cross the knee joint, but the gastroc does, when you bend the knee and keep the knee flexed, you're isolating the soleus. When you do it with the knee extended and you're plantar flexing the foot, you're recruiting the gastrocnemius. Muscles can't be effective at both joints that they cross at the exact same time. So with the leg or knee in the extended position, the gastrocnemius is very strong. When you bend the knee, since the gastroc crosses the knee and bends the knee, and you then are isolating the soleus muscle, okay? Because you bent the knee, you activated the gastrocnemius at the knee, okay? This one right here is a third plantar flexor. It has a very long tendon. It's called the Plantaris Longus. It sounds like Palmaris Longus of the hand. It's called Plantaris Longus. And if we, let me see if I can zoom in here a little bit. If we zoom in right here, you can see the belly of the muscle right there. And then here is the tendon. And it's the third muscle that helps to make up the Achilles tendon. Okay, it's weak. It's just synergistic. It's a weak ankle plantar flexor. So you have the gastrocnemius, you got the soleus, and the plantaris gets sandwiched between both of those muscles. Let's see if there's another one that we need to look at. Yes. Okay, let's look at this one here. All right, so let me explain what we're looking at here. This is the posterior view of the leg. And what was done here is that all the superficial muscles were dissected away. So the gastrocnemius and the soleus was removed, and so was the plantaris. So these are the deep muscles of the posterior compartment. A very important muscle that doesn't get enough attention is this one called the Popliteus. It's the key that unlocks the knee. It's the key that unlocks the knee, the key that unlocks the knee. Look at the direction of these fibers. They run on this oblique angle, and it crosses the knee joint. That's all it does. It crosses the knee on an angle. In order for your knee to flex, the knee has to unlock first. And in order for the knee to unlock, the tibia has to medially rotate just a itsy bitsy bit. By having the tibia medially rotate or internally rotate just a tad, that subtle and slight rotation of the tibia unlocks the knee. Once it's unlocked, the knee can flex. So the popliteus muscle is a short muscle on this oblique angle. We say it's the key that unlocks the knee. We have a tibialis posterior muscle. We have a flexor digitorum longus and a flexor hallucis longus. So if you look at the flexor hallucis longus, it's a posterior compartment muscle. And if you look at it, it's on the lateral leg, because here's the fibula. That's the head of the fibula right there. So here's the flexor hallucis longus. The belly of the muscle is lateral, but then it inserts medially. It crosses over and inserts medially. It's one of the triggers of a bunion of the foot, because the pull of action going from lateral to medial, the direction of that tendon pulls the great toe towards the pinky, creating a hallux valgus, or a bunion formation. Let me take a look here. Let me show you this one too, one more time. Yep, so here's the anterior compartment. So just now we saw the tibialis posterior. Here's the tibialis anterior. We saw the flexor digitorum longus. Here's the extensor digitorum longus. And deep to the extensor digitorum longus, if we peel this away, just on the inside, you can see a little bit of the tendon. Just before we did the flexor hallucis longus, here's the extensor hallucis longus. And similar, the belly of the muscle is deep, but it's lateral on the leg, but the insertion is medial. It's this tendon right here. That's the extensor hallucis longus. So again, the line of pull of that muscle and tendon starts lateral, but is medial on the insertion. So the great toe pulls in the lateral direction. When you pull the great toe towards the pinky, you get that bunion that forms here. They call that hallux valgus, or bunion. Okay. Okay, let me stop the recording here.